Hello, this is Dr. Gay from First Look MRI, and this is a 40-year-old male with complaints of pain after swinging a baseball bat. The doctor thought maybe they had a bone injury or maybe a tear of their triangular fibrocartilage, a little cushion in the wrist. And as we look on this view here, we can see that there is no tear of the triangular fibrocartilage. There's a little horizontal band here, which is a little cushion called the triangular fibrocartilage, and it's a shock absorber between the distal ulna, which is this bone, and these are the bones of the wrist, the carpal bones. There's the lunate bone, so we see that little gray thing going sideways, or this dark area. That's a nice normal triangular fibrocartilage, a cushion. So there's no tear there, so we're going to look elsewhere for problems. This big bone here is the radius of the forearm, and again, these are the carpal bones of the wrist. Scaphoid, lunate, triquetral bone here. Here's the hamate bone, capitate bone. This is called the trapezium, trapezoid bones. And there is a problem in this bone here. This is called the hamate bone. And it looks good here, looks good here. But on this view, it looks a little bit darker than the other bones. And the hamate bone has a hook. We'll see on a different view. We're going to look in a view like this. There's a part of the bone that pokes down right here. This should be just as bright as this. Fat is bright, marrow is bright on this sequence. So we should see bright marrow, bright marrow, bright marrow, but you see there's not bright marrow, so this is edema within the bone. It's just hard to appreciate on this view, but this is slicing right through a fracture of the hook of the hamate bone. Now we're going to look at another view. Let's look at this one. This is the ulna. This is the radius here. Now we're going to go into the wrist. These are all those carpal bones, and we're going to look over here for that hook of the hamate bone, and this is the hook. There's a pointy part here. This all should be one continuous bone, but instead we see there's a separation here, a little gap. So this is a fracture through the base of the pointy part, this little hook of the hamate bone, causing their symptoms. We'll put up another view to look at the same thing. Now in this one, marrow should be dark, and anything abnormal is bright, just the reverse of before. So nice dark marrow, nice dark marrow. These are all tendons. This is that hamate bone, and we see, wait a minute, instead of being dark, it's bright, which is abnormal. We also see this horizontal band of brightness. This is a fracture line, a little bit of fluid within the fracture, and this piece, this hook of the hamate bone, is separated from the body. So there's a fracture line that goes just like this, and this can be really, really painful. And so this is that pointy part, the hook. We're going to look at this in one more view called a sagittal view. The sagittal view is looking in profile. This is the palm here. Here's the back of the hand, back of the wrist, front of the wrist. Now we're going to go over here to try to find this hamate bone. And we see it on this view. So here is the hamate, and the hook goes over this direction. And we see that there's a white line that's fluid or edema or hemorrhage here inside the fracture. And this little piece of bone should be fused with this bone, but instead we see a fracture line. This is longitudinally oriented, and there's brightness on both sides, which means there's marrow edema. So a fracture through the base of the hook of the hamate bone. And that's it. Thank you so much.